Hello, my name is Dr. Chad Miller. I'm speaking to you today about neuropathy and neuropathy-associated symptoms and what we do at Attain Health Omaha that is above and beyond what is typically done for people with neuropathy. And usually people with neuropathy are kind of given no hope, and I'm here to tell you that there is hope and there is room for improvement. So what is neuropathy? Well, neuropathy is, we're going to get into it. We're going to get into what causes it and what can be done from a conservative as well as a medical point of view on how to address the neuropathy symptoms. So neuropathy is more and more pervasive. It's across the country, 20 plus million. This was a couple years ago, 20 plus million Americans. It's probably even higher. It's growing every day, every year. We're seeing the statistics go higher and higher. But basically, your electrical wiring is breaking down. Your feet and hands can't talk to the brain, and the brain isn't able to talk to the feet and hands. It's a loop. Everything's working together. So it's not just, say, burning in your feet if you happen to have that. It's more than that. It's the whole complex. Everything is talking to each other, and they need to talk to each other. And if they're not hearing from each other, things break down, not just in your feet, but elsewhere. And we'll get into that. So what does peripheral neuropathy mean? Basically, peripheral means away from center, so away from the brain and spinal cord. So your central nervous system is your brain and spinal cord. And your peripheral nervous system are the nerves that emanate from there and go out to, say, your fingers and toes. Neuro means nerves, obviously, and then pathy means abnormal or disease process. So the leading causes of peripheral neuropathy, not necessarily in any order, but basically diabetes is most commonly known, but statin drugs are a big player, chemotherapy and radiation. Very common result from chemotherapy and radiation. You'll get neuropathies in the hands and feet, and just kind of depends. Damaged nerves, trauma, the years of abuse that we all have on our bodies. And then chronic inflammation, which is a big player. All right, so the signs of peripheral neuropathy, of course, numbness, burning, sharp electric pain, you have difficulty walking, sometimes you have weakness and loss of balance issues. Again, the nerves are talking not just at the feet, they're talking to the spinal cord, to the brain, and everything works together. And when you can't hear each other, if they can't hear each other talking to each other, then things break down and your function is affected. So the symptoms depend on which nerves are being affected. So we have sensory nerves, we have motor nerves, and then autonomic nerves are your autopilot nerves. If your sensory nerves are affected, then obviously the sensations are affected, such as you'll start to see negative symptoms such as numbness and dulled sensations, but then it tends to progress, and then you'll start to feel the sharp and the burning and the like pillows under your feet, or difficulty feeling like almost like you're walking on balloons. It's it's pretty hard to function when you're dealing with that. And then you have motor nerves that can get affected. You'll have difficulties with movements and obviously stability. And then the autonomic, which most people aren't really familiar with, but if the autonomic nerves are affected, then you'll start to see changes in your blood pressure, in your temperature, digestion, you name it, bladder function, sexual function. All right, so sensation changes. Basically, any damage to the nerve means it can't relay the information as well, and so then that information is either being skewed or not sent at all. And sensory nerves send different signals. So we have different sensory nerves that send vibration, different sensory nerves that send touch or position sense, and then we also have sensory nerves that send pain. Well, if some of the sensory nerves, which require more fuel and oxygen, we'll get into that, some sensory nerves, such as the ones that sense position sense, movement, vibration, those require more fuel to stay alive, whereas a pain nerve doesn't require much to stay alive. So if we see issues with inflammation or changes in the metabolism or the physiology there, the first ones that are going to break down are the guys that send joint position sense, send vibration sense, and those sensory nerves inhibit pain, and that works in the effect of you hurt your elbow, rubbing your elbow actually helps to decrease the pain from the funny bone. Well, same thing happens here, except for you're trying to rub the funny bone, but if I can't feel it due to decreased fuel and oxygenation to those nerves that would allow me to feel this, then the pain goes up uninhibited. And so this is the breakdown that typically happens. All right, so we need three things to stay alive: fuel, oxygen, and activation. If the nerves do not have any one of those three, then the nerve will break down. And chronic inflammation, it's the big player in a lot of what we see. And you know, if you're taking medication to get rid of the pain, but you're not addressing the issue that is causing the problem in the first place, you're still going downhill. So lots of studies on this, but basically you cut your nerve, you will change your brain. So you'll see loss of balance, memory loss, you'll see issues with emotionality like depression, anxiety, and it can even lead to, you know, some pretty scary stuff like Alzheimer's and dementia. Basically, if you don't use it, you will lose it. So what do we need to heal the nerve instead of just dampen the pain? We need good fuel, we need good oxygen, and we need to decrease the inflammation, as well as we need activation. So the appropriate amount of activation is the key. So if we're fatigued and tired and we cannot, you know, get up and go, you can't expect a person to go run a couple miles, right? So you want to have them fueled up. You want to exercise them within their tolerance and build them up over time. So you're not going to get somebody who's sitting on a couch to go run a marathon. You have to kind of build them up and work them up to that. And same with these fragile and beat down nerves, we have to do the same thing. So we build them up within their tolerance and go with the no pain approach, as opposed to the no pain, no gain approach. We don't want to fire the nerves that send pain. We want to fire the nerves that will work to inhibit pain and get us better function. All right. So we want to stimulate the nerves and muscles with exercise and stimulation. We want to stimulate them electrically. We can do that with some of the tools that we have here at this office. And we want to stimulate them biochemically. We can do that with nutrients that actually work to help decrease pain, of course, but we want to increase blood flow. We have to improve their metabolism, reduce the inflammation, and basically provide the vital nutrients for repair. That is the key. All right, so when nerves start to die, they need to be fueled up and stimulated and cared for. It just kind of makes for common sense. Instead of, you know, the alarm bell is going off because my pain sensory fibers are sending their signal, let's just tune out the alarm. You know, instead of putting out the fire, all we're doing is dampening the alarm. So we want to make it to where you can, you know, live your life and not have to hear that alarm so much, but also build you up to where you're doing that yourself. So it's kind of a teach a man how to fish program, as opposed to just here's the fish and you will rely on me for the rest of your life pharmaceutically kind of thing. And that's not the way we want to go. We want to get you out of this. We're the only clinic in Omaha for sure that takes this approach. So we're using cutting edge electrical therapies. We're using injections to speed healing, decrease inflammation, obviously decrease pain, and we're using the appropriate exercises and rehabilitation of function. We want you functional. All right. So neuropathy is progressive. If you ignore it, it will continue. If you only dampen the pain signal, it will progress. It's just the way it is. So we need to do more than just turn down the pain volume. We need to correct the issue. So really you need to address the underlying metabolic and neurological problems to have success. You can't just dampen the alarm signal. All right. So there's work involved. Obviously, it's not just, you know, lay there on the table and accept the force kind of thing. You must be willing to make some changes that got us into this place, and we need to make accountability for your health. You have to be accountable. So you have to fuel the body correctly. You have to stimulate that within its reason. So there is a happy medium. There are people that push themselves and then just rub some dirt on it and push themselves through and then pay for it for 3 days. They're also digging themselves in a hole, just like someone who just sits on the couch and does nothing and tries to avoid the pain. We want to work your way out of this. So you have to take accountability. Now we're in network with most of your plans and everything like that, but you have to put the time in. So there's a time involvement. We're training for a marathon. This is not a sprint. There's going to be some work involved, and you have to be willing to do that. Now, it's not ridiculous, and it's easy to kind of incorporate into your day and your week. But again, you'll have to be thoughtful about how we're getting and working out of this situation, this condition. All right, so things to think about. How serious is it? If it's not too serious, obviously, people don't want to put in that kind of effort. But if it's pretty serious, I mean, let's get to it. And the more time you let this progress, the harder it is to let go. So, where do you see yourself in the next few years? Are we still doing okay? Or do you feel like it's going to affect your quality of life? Is it affecting the relationships? For sure, it affects a lot of people's sleep, their energy, and their ability to go out and, live their life. And so we're not life or death people, but we're quality of life people. All right, so if you feel like this is something you're interested in, again, you have to find out to see if it's a good fit or not. But give us a call. We have an office. Again, 140th and Center, kind of South Central Omaha. Pretty easy to get to, and we'll be happy to sit down with you and see if this is a right fit. So it's got to be a right fit for you. Obviously, we can't promise a cure or anything like that, but we can't also, help everybody. If the nerve is cut and the nerve is gone and there's no viability to exercise that pathway, then we will tell you we can't help that kind of situation. But if there's viability within the pathway and we feel we can help you, we will let you know. And then also just like, is this a good fit for you? Does this feel like something that you would want to move forward with? You got to sit down with us and see if this is the right fit for you. So, like I said, give us a call. Can't hurt. 402-505-3210. You can always shoot us an email if you have questions or want some more information. AttainHealthOmaha@gmail.com is the best way to get a hold of us. And we'd be happy to discuss whatever questions you might have. All right. Thank you. Take care.